Dr. Stephen Smith from Pediatric Hematology and Oncology at Memorial Care Miller Children's Hospital. I'm providing an overview of a quality improvement project titled Standardization of New Oncology Diagnostic Evaluation and Staging. The primary goal of the project is to improve the new diagnosis workflow via decreasing time spent reviewing new oncology diagnosis workup and staging, decreasing time spent placing new diagnosis orders, utilizing order sets, and decrease time documenting new oncology diagnosis workup and staging using a smart list that will contain diagnosis-specific smart phrases. With this, we will be able to apply additional time supporting and educating our patients and families, and will reinforce our patients and families' trust in providers by reducing provider variation in new oncology diagnosis workups. The secondary goal will be to improve our pediatric hospitalist nighttime workflow for new oncology diagnoses, and tertiary goals to expand to include hematology conditions, as well as add some additional oncology ancillary information for specific evaluations for clinical trials, some of our standard operating procedures, differential diagnoses, algorithms, and patient education content. There will be a project survey that will be distributed to both the pediatric hospitalists and pediatric hematology and oncology. The survey will be distributed before and after the project implementation, with the goals being to assess the impacts of the project on provider variation, efficiency and time, evidence-based medicine, risks of errors, and patient care. This is a preview of the survey. I tried to keep it as brief as possible. I do appreciate your time and consideration in completing the survey, both before and after the project implementation. Along with the project will be a PDF that has links for references, key explaining things, a preview of the smart list, and then each of the specific diagnostic evaluation staging. So for ALL, a preview of the order set for ALL with instructions on how to add it. Acute myeloid leukemia, aplastic anemia, a preview of the aplastic anemia order set, Hodgkin lymphoma, and not Hodgkin lymphoma. This is the smart list and the preview, and as mentioned within the PDF, there will be a link to the following video that goes through how to implement the smart list and smart phrases into your note. So within your note, you will type in .pho new diagnosis. PHO being pediatric hematology and oncology. Once you have the smart list in, you can then select pluses for explanations of the workup. So for aplastic anemia, it goes through and explains what is being done and why. Control Z, and it goes away. Then select the abbreviated version as the specific workup. Next, for Hodgkin lymphoma, pluses having the explanation of the workup. Once reviewed, Control Z, and then select the abbreviated. Easily go through and type to be determined as we are going through the process of the workup, and then update later. For a new diagnosis of leukemia, the workup with explanations. Once reviewed, Control Z, then the truncated or abbreviated version of the plan. And lastly, a new diagnosis, non-Hodgkin lymphoma, explanation of the staging and diagnostic evaluation, then the abbreviated version. The project status: currently have distributed the survey to the pediatric hospitalist along with this project overview video, and has been also simultaneously provided to the pediatric hematology and oncology group. With regards to the order sets, we have begun the process by completing and submitting an information service request to Epic. Once this gets processed and approved, we will then develop the order sets and then distribute them to both the Pediatric Hospitalist Group and the Pediatric Hematology and Oncology Group. After this, we will then redistribute the survey for the post-project implementation survey responses to assess the impact of the project. Appreciate your time and attention, and if anybody has questions or comments, please feel free to reach out to me. My email and phone number provided.